Good afternoon, this is Dr. Do again. This video is on alphabetic list of problems, still on letter D. I'm going to talk about dermatitis today. I have a couple videos about the derm problem, the skin problem, like skin cancer, melanoma, and in general about the skin structure, the function of skin, and briefly mention dermatitis. Today I'm just going to talk about dermatitis, different kind of dermatitis, how to recognize them, what kind of dermatitis can be managed at home, what kind of dermatitis you need to see the physician, and is there any dermatitis associated with the emergency visit. Actually, dermatitis, like I said, if there's one type of dermatitis, for example, the atopic, share the same mechanism as the anaphylaxis. IgE-mediated reaction could be serious if this dermatitis is part of the general, but usually it's not. So unless you have a company like urticaria or systemic anaphylaxis cause the anaphylactic shock, if that's the case, you need to see the emergency. Other than that, the simple dermatitis, regardless of what kind, either atopic or irritant contact dermatitis or allergic contact dermatitis, or the seborrheic dermatitis, usually not require emergency. So unless it occurred around the eye, or so you couldn't open your eyes, or it's very serious, usually that is related to the other category of problem. Just the dermatitis, the 4 type of dermatitis I mentioned here, really I cannot think any associated with emergency situation, unless, like I said, associated with urticaria, anaphylaxis, cause the shock, then you need to visit the emergency. So basically, the derm problem actually is kind of simple, sounds like simple, actually it's not. There's so many, the symptoms is simple, itchy, pain, that's probably how you feel it. But the signs, like the rashes, different kind of rash, it's not that simple. Different disease have, for example, the psoriasis just had the plaque and arithmetic plaque and scaling, and also there's some macules, there's some patchy, there's some papule, pustule, or blister, or bullae. These are so many different categories to define what kind of rash you have. So regardless if you have skin problem, if it is new, if it's really itchy, bother you, or if it is extensive, so you really need to see the dermatologist or see a primary care physician, and they can manage. If they can't, they will refer you to the specialist dermatologist. So let's talk about the 4 type of dermatitis. I'll try to explain. Sometimes the difference or differentiation between each of them, it's not that sharp. It's kind of vigorous. Could be one, could be the other one. So the first one is atopic dermatitis. Like I said, atopic dermatitis, usually the skin reaction belong to the type 4 hypersensitivity, which is, for example, the contact allergic dermatitis. That kind of allergic reaction is a delayed hypersensitivity. This atopic dermatitis, however, is type 1 hypersensitivity, which is mediated by the IgE. So IgE bind to the master cells and release the histamine or some other chemicals, serotonin, histamine, to the local area, cause the itchy, the erythema, redness, and also some rash associated with this. And the treatment is pretty just anti-itch reaction, like the antihistamine, anti-itch, and also the if this is severe, can use some topical steroid to treat it. Regardless, if you have this, usually atopic dermatitis tends to occur in this folding, like anterior arm, around the elbow, anterior elbow area, folding area, or under the breast. So these are or up the knee or the leg. So if you have this kind of, it's kind of rash, itchy and red. So if that's the case, you probably need to see your physician first, especially if it is extensive. The whole leg or the whole arm or the whole body has those kind of arithmetic rash, and not huge, small papules, or so you need to, usually it's red, so you need to see your physician to make sure there's nothing more serious problem going on. So if the diagnosis of atopic dermatitis, then treatment is quite straightforward. Just a topical cream, either antihistamine for itching or anti-inflammatory, or such as the steroid. So there's another allergic. One is there are another two types of contact dermatitis. One is caused by the allergic. That's quite straightforward actually. If it's not serious, for example, you're allergic to a nickel or wearing a watch or jewelry, you know it. You have just it's a pattern of either the chain of watch or the jewelry chain. So if that's the case, then quite straightforward. You remove the contact, remove the nickel or metal material, then put some ointment from over the counter, will recover. There's another called irritant contact dermatitis. Usually it's caused by the chemicals, either professional or the cosmetic chemicals cause that contact dermatitis. If that's the case, you need to remove the chemicals. Usually you probably need to see the physician. If, for example, if the chemical caused dermatitis probably is not as easy managed as nickel caused contact allergic dermatitis. If the irritant caused, probably usually it's deeper, cause a little erosion, so then probably need to manage by a physician to help it recover, and also to limit it getting deeper to the tissue. And there's another type of called serobic dermatitis. Usually occur with the area with dense hair in the scalp or the eyebrow or the armpit. So this is because associated with the follicle or hair follicle, you feel that it's kind of the rash probably could be the pustule, which contain the purulent material like some pus, so pustule and crusting, and you associate sometimes with bacterial infection. If it is just a local or small area, for example, just around your eyebrow or on the back of your scalp, you probably just can use some antibiotic ointment from the over-counter. But if it is extensive or crusting, pustule or crusting yellowish, big area, then probably you need to see a physician, need either debris to get rid of those crusts, and plus put some effective antibiotics ointment to make sure it very well treated, and so not going to getting deeper or getting a larger area. So this is the dermatitis I can think of. Of course, there's some other like the rosacea or the urticaria. Those kind of problem is also, I think it's kind of, or the acne. If it is extensive, you need to see a physician, especially for the acne. It's cosmetic reason, and also the rosacea is immune caused, so need to be managed either by fungal or bacteria, so your physician will help you to manage. Urticaria, of course, has to be managed by physician, especially if it is associated with systemic problem, hypotension or anaphylactic shock. So that's the usually it's not, but if it is the case, then emergency is the place to go. So I'm going to stop here. For this video is for dermatitis. I hope it helps, and some of them you can just manage at home, but if it doesn't getting better, see your physician to manage under medical advice. Thank you for watching. I will see you next time.